Good morning. Welcome to VONR1202 Pediatric Nursing. I'm Dr. Shanna Chapman, and I'm excited to be your instructor this semester. Kids are hard. I always liked kids the older they got when they were old enough that they could tell me what was hurting them or what was wrong, because before they're able to verbalize that, a lot of it is going to go off of your assessment skills. Here is my contact information. I do ask no calls or texts after 9 p.m. I am an early riser, which means that I go to bed early. But you're always welcome to shoot me an email any time, day or night, and then I will get it the very next time. Remember, we're going to have class this semester in Moody 113. So I look forward. I will send you guys out the information on what time and the date, as we are still looking at that. But the introduction, pediatric healthcare offers a wide array of opportunities. Kids are resilient. Kids go through things and bounce back quicker than we anticipate. However, I'm going to offer you with this one grain of thought that we do know that kids experience a lot of adverse childhood experiences, ACEs, and ACEs do follow these kids throughout their lifespan and can actually cause some adult healthcare issues. I've actually spoke on a national basis at multiple conferences and actually wrote a couple of textbook chapters on ACEs. ACEs are bad, and I think the majority of kids go through them, and it's up to us to help them develop resiliency so that they can mitigate those ACEs. When you look at being a nurse for peds, you also have to remember that you have a responsibility to the entire family. When you have a kiddo, you're not just treating them, you're treating the caregivers, any siblings, because it really does affect everyone. You will want to set kids up for success. You're usually surrounded by a supportive team and lots of fun. The other good news is your patients often get better, and you get to peek at the world through a child's eyes. So in this course, we are going to use FA Davis Advantage and ATI. So you want to make sure that you know how to use it properly. It's going to be 10% of your total grade. We are going to do some classroom lecture and discussions. You are going to have some videos. We're going to have some student presentations. We're going to have 14 different modules, and you must have a 75% to pass the course. We are going to be talking about holistic nursing care of children and their families, age-appropriate evidence-based care. Growth and development is actually going to be covered by Mrs. Pipkin in the growth and development course, but we're going to be talking about a lot of acute and chronic health conditions. Your assignments are going to be a combination of exams covering didactic content, as well as some of your regular assignments. You're going to take all your exams in ATI. You're going to have your predictor ATI as well as remediation, and we'll talk about that whenever it comes due. These are not for a grade, but does show us where your knowledge is so that we can do remediation and get you where you need to be. You're going to have some projects. Your chapter or module exams are going to be 10% of your, or 10% each. Your final exam is going to be exam 5 and not comprehensive. Again, all of your exams will be in ATI. You're going to have some practice assessments, proctored assessments, remediation. So lots and lots of comprehensive stuff this semester. Don't let it scare you guys, because again, we're here to walk you through this. It's more that we want to get you to where you need to be. Your papers, you're going to have a disease process in the pediatric population. You're going to have a written assignment in abstract form, which is about 300 words. We're going to do some class presentations. We're going to do an educational project about knowledge deficiency in specific pediatric population. We're going to utilize growth and development principles. We're going to do some group projects. We're going to produce some educational material, and we will not be distributing them at the health fair because of the health fair isn't until fall, unfortunately. So tips for success: be present and prompt. Failure to email, call, or text will result in a no call, no show for attendance. Your computers are required. All cell phones should be on silent. You should always complete your pre-assignments and chapter readings before coming to class. You're going to participate in discussions and ask questions. No sleeping in class. No sidebar talking in class. Be respectful. And I don't mind to be recorded. Just let me know if you're going to be recording. And we will have recording on Echo 360 that you can go back and look after the fact. Tips for effective communication: seek me out. Don't wait until you're doing poorly in the class to ask for help. Remember that we are here to help you succeed, but if you're struggling, if you don't say something to me, I may not know it. And if I do know it, this way, perhaps there are strategies or things we can do to help you. Keep me in the loop. Communicate if problems arise. Again, if I don't know, I can't help. My goal is your success. My goal is not just to pass students through, but to educate you and give you the knowledge needed. Show respect to each other and to me. You are a future nurse. We are the most ethical profession. Remember that your instructors are considered experts in their field. So again, even if you disagree with them, that is okay. We don't know everything. Just show respect to whichever professor it is. Active listening. Do not ask questions if you're not prepared to listen actively. And don't be intimidated. Nursing instructors always prefer someone to ask questions if they don't fully understand. We are here to make sure you are successful. I look forward to a great semester, and if you guys have any questions, let me know. Thank you.